So Jim had asked me to talk about food safety issues for salmonella and pork, and I said, how long do I have? And he said 30 minutes, and I said, well, we might be able to do that in about 3 minutes, because I hope what I'll talk to you about is where we are with salmonella control in pork in the U.S. and some of our success stories. What we'll do is introduce you to some of the CDC outbreak data concerning pork, our FSIS carcass data, introduce you to a systematic review that Dr. McKean was involved in. And one of the things I'd like to finish up with then is to talk about what the Danes are doing on salmonella control on their farm, and give you some ideas of why or how something like that might impact the United States. When I first started at the Pork Board, we worked with Dr. Craig Hedberg at the University of Minnesota to get data from the CDC outside of what's just published in the MMWRs, looking at the etiology of foodborne outbreaks. It's about time to do that again and do another 10-year look back. But if you looked at the percent of foodborne outbreaks with a known etiology in the years from 1990 to 97, pork was only involved in as the known vehicle for the contamination in 4% of outbreaks. And when you looked at the salmonella outbreaks involving pork during that time, it did cause 37% of the 62 outbreaks in which pork was implicated. But those 62 outbreaks was only, or where pork was implicated, but pork was implicated in only 3% of the salmonella outbreaks. And I'm having to look and say why my numbers don't match up, but yeah, they do. My 23 outbreaks is 3% of the 789 salmonella outbreaks for all vehicles during that time. So our take-home message is that even though salmonella is the most frequent cause of outbreaks involving pork, pork outbreaks are a very small percentage of salmonella outbreaks in the United States. And as we've monitored what's been published in the years since then, it appears that that picture has changed very little. So that's what we're seeing on the public health side from foodborne outbreaks. We also work very closely with FSIS looking at carcass contamination with salmonella. For those of you who are familiar with their ranking, category ranking of establishments, we have HACCP testing that's done, and it's compared against the baseline that was conducted in 1998, which was 8.7% of carcasses. Category 1 are those establishments that fall below half of the baseline. Then there's a transitional phase. Category 2 is those who fall from half of the baseline up to baseline, and Category 3 means you're over the baseline. If you're a Category 2 or a Category 3 establishment, you may have some special attention from FSIS, and they will spend a little more time in your plant than if you're a Category 1 establishment. So as we looked at 2009 monitoring for the first half of 2009, you can see that 154 of the establishments were well under the half of the baseline, and we only had one establishment falling into Category 3 that was over baseline. It tends to fall that the smaller establishments are having a little harder time making progress, and so that we do know that Category 3 was a small establishment. What our trend over time is, and this is looking at our large plants, our large establishments from 1998 through the third quarter of 2008, if you compare it against baseline, which was 8.7%, in third quarter 2009, the large establishments that tested were at 0%. So there's been a consistent downward trend in these large establishments. The reason that we're talking large establishments is that they do produce the vast majority of pork that goes into the consumer market. The small establishments don't put that much pork into the consumer market in the United States. Our last FSIS baseline study was in 1998. In 2009, FSIS has started a pilot study in large establishments with the expectation to do a nationwide baseline study in 2010. There will be some kind of a comment period to the or the committee, not necessarily a Federal Register comment period. And one of the things as an industry that we kind of have a question about is we expect to see a pretty low prevalence in that baseline. That baseline might be 2% versus 8.7%. So does that mean that if you're between 1% and 2%, that you're going to garner the extra attention that FSIS is giving to Category 2 right now? So I think there's some of those things that we still need to work out. You know, now that you've made all this consistent improvement, what is the incremental improvement that can still be made, and is that going to have any public health impacts? Next thing I wanted to mention that we've been doing with pork, and I think that this is a great example for those of you who are involved in food safety on how to assess whether your interventions are making an impact. We, at the Pork Board, had funded a study with Dr. McKean and then Dr. Ned O'Connor and Jim Dixon at the Iowa State University, and they did a systematic review of the literature on salmonella and pork production chain from slaughter to cooler. So it's similar to what you do in evidence-based medicine in human medicine, where they actually went through the literature, evaluated literature on the strength of the studies, and did an analysis of that. If I get in trouble on this, McKean's going to jump in here and help me out. But the task that they were assigned was to assess the points of introduction and amplification of salmonella species from slaughter to the cooler. They did their literature identification in February of 2007, and they looked at numerous databases that were both peer-reviewed journals as well as scientific meeting abstracts, and the literature was evaluated for relevance to the systematic review. The relevance criteria were studies that had the same cohort of pigs or pigs that were slaughtered on the same day. They had to measure salmonella species at more than 1 point along the chain in the plant, and there was no exclusion because of non-random selection or based on particular culture methods. And as you'll see in the strengths and weaknesses, the culture methods varied greatly. So they extracted their data by arranging all outcomes to be described as after a processing point. So stun, bleed, kill, scald, dehair, singe, polish, etc. Were some of the points that they measured along the chain. And if the location was unclear in the literature as they reviewed it, they consulted with other experts to figure out where to put it into in that chain. Started out with 7,635 citations. 139 came from conference proceedings, 43 from final review articles. So after they removed their duplicates, which is why you had graduate students, they had 5,116 citations. Those they looked at and actually started reading abstracts and saying, do these qualify or don't, and started excluding. 3,490 of them, didn't talk about salmonella species at slaughter. 461 of them were not published in English, and only 90 only sampled at 1 point during slaughter, so they didn't show a reduction throughout the process. They had 15 manuscripts, over 40 studies from around the world, and basically they were able to put together a table showing from bleed all the way to 18 to 24 hours after chilling what happened to the prevalence of salmonella throughout the chain. And as if you look at your maximums along the right-hand column, you can see that they definitely do show a downward trend. So their conclusions were that the results provided empirical evidence that salmonella species prevalence on the carcass decreases as the carcass moves toward the cooler. So bottom line is the interventions in the plant that are employed are working. Was that too simple, Jim? No. Good. So the last little bit of the talk I'm going to spend most of my time on is to talk a little bit about what's happening with the Danish Salmonella Control Program. Many of you may be aware that they started the program almost 15 years ago, a little more than 15 years ago now. So I'll give you an overview of what they're doing in monitoring, what they're doing for on-farm controls, some of the limitations and successes of the program, and implications for the U.S. They started in 1993 implementing the Danish system, and it came about because they'd had some very high-profile salmonella outbreaks with some mortalities involved that were traced back to pork as a source. And so the pork industry there, as well as public health, decided that they had a public health need to do something to control salmonella. The program is based on monitoring of herds for salmonella status, and the monitoring is done largely at the slaughterhouse, and they do that using meat juice extracted from a piece of diaphragm that they cut out at slaughter. They use something called the mixed ELISA, which is a test that they've developed in Denmark, and they index for a 3-month rolling index. So the most recent month is weighted 3 times higher than the 2 previous samples. So that way they feel that if somebody, you can roll people into a higher index more quickly than if you just weighted them equally. It takes longer to roll them out of that status. The reason I have the asterisk by those is that from their first implementation until now, they have changed their cutoffs on their mixed ELISA for saying what's a positive versus what they started out with. And the index was introduced in 2001. They divide their herds into 3 categories, but they kind of have 4 categories. So level 0 would be a negative herd, where they're not finding any seropositive animals. Level 1 is an index of less than 40, level 2 is 40 to 70, and level 3 is over 70. So their goal for this program was if they could reduce salmonella in the primary production, it would lead to reduced levels of salmonella in the slaughterhouse. And so they've always referred to it from the beginning as a stable-to-table idea. So seeing that we always talk farm to fork, in Denmark it's stable-to-table. They've done a lot of studies to say what can we do on farm that would consistently help us control salmonella. And the things that seem intuitive, and they've done marvelous studies, and they have great data, and they've spent a ton of money looking at this, and a ton of science hours. They have really, really, really studied this inside and out. The things that intuitively you think would work, the all-in, all-out, hygiene, has had varied results. It has not consistently controlled salmonella. The things that they have been able to show that are consistently controlling salmonella are the addition of organic acids to their feedstuffs, what they call home mixed feed, and what that means is more of a coarse grind feed. So instead of using a fine grind pellet, they're using a coarse ground feed that is not pelleted. Now that's totally counterintuitive because you'd think heat treating a pellet, you're going to get salmonella killed that would be in the feedstuffs. The theory is that the coarser grind feed actually layers out within the gut and allows for a different pH within the gut that is not conducive to salmonella growth. So it has nothing to do with salmonella contamination of the feed. It has everything to do with the environment in the pig's gut. And then they also have gone to liquid feeding systems. Within their liquid feeding systems, also, though some of them actually do ferment the feed, you have some fermentation in those liquid systems just because of the way they're sitting in the liquid before they're delivered. So those feed controls are really the only things that they found that have been consistent in helping them reduce salmonella levels in their positive herds. They've had a pretty good correlation between their index and carcass contamination. So if you went back and said what they're targeting right now is a 1.2% carcass contamination in their plants. And if you look across the line, their level 0 herds that are negative are under 1% of carcass contamination. Their level 3 herds, which are actually killed at a separate time, they kill them in a separate plant at the end of the day and try to avoid any cross-contamination with their lower level herds. Those herds are over 5% carcass contamination. So they've been able to show a pretty good correlation between their index and what's happening with carcass contamination, but overall they're unable with this program to move even their level 1 herds, which would be anything short of 40, down to their target. Jan Dahl, who is with used to be Danish Bacon and Meat, now it's Danish Food and Agriculture, presented at the 2009 Safe Pork meeting that was just held up in Quebec City, a study that they had done of 22 establishments of varying sizes in Denmark. Those establishments killed between 242 head a day up to 11,200 head in a day. And they measured Salmonella burden as the number of pigs coming from positive herds coming into the plant. And they looked, and so if different herd levels, so the higher, if you're coming from a level 3, your Salmonella burden those animals are bringing into the plant was higher than pigs coming out of a level 1 herd. So they found that the Salmonella burden was influential in end carcass contamination up until 40 positive pigs were introduced to the establishment. After they got 40 positive pigs introduced to the packing plant, cross-contamination in lairage and perhaps other places in the plant prevented any positive influence from bringing fewer positive pigs into the plant. So their conclusion is that for medium to high prevalence countries, even drastic on-farm reductions would have little effect on carcass prevalence for large establishments. And when we were in Denmark in September, I mean, Jan had basically said any plant he felt that killed more than 400 pigs a day was not going to benefit from on-farm controls. Dr. Scott Hurd, who is the former Deputy Undersecretary for Food Safety at USDA and an Iowa State faculty member as well, traveled to Denmark several years ago and actually worked with the Danes to do an analysis of their program as well. And they did a model of what benefits were achieved through on-farm versus what was achieved at slaughter. And their conclusions from the abstract come out that the on-farm program reduced risk in the early years from 95 to 98 when it was first really getting up and going. But any improvement they've seen since 1998 was due to improvements in the slaughterhouse. They felt the on-farm program was important if you had poor slaughter hygiene, but when you looked at the number of cases in Denmark of humans, that the on-farm program alone would have reduced average annual cases by only 65, and they had reduced average cases by over 300. Here's what we looked at as far as these are thousands of carcasses along the y-axis, and they had a significant decrease in the number of positive carcasses coming through the plant between 95 and 2003. So they felt they decreased 230,000 positive carcasses per year. If you broke that out to what they attributed to the on-farm program versus the farm plus slaughter improvements, you can see that in the first couple years you saw some improvements, significant improvements from the on-farm program, but after 98, all improvements were from what happened in the slaughter. So the 230,000 carcasses that they decreased, 110 of those they felt were due to the farm-only controls. So we have the early impact, and later on, as we mentioned, it was due to slaughter improvements. Now what they did in 2003 is they changed their OD for calling a herd positive, or a sample positive, and it went from a OD of 40 down to an OD of 20. So they moved their positive cutoff down in half, excuse me, and they also went to indexing their herds. So you look at what happened with Dr. Hurd's sites here, the farm only, if you looked at 2003 slaughter, you would have had your first decreases right away, and it would have been just a flat line. So they improved with the 2003 program their control, but they didn't improve more than they would have with just the slaughter improvements. So their conclusions were that the on-farm program mattered a lot more when you had poor slaughter hygiene. As far as human cases that were attributable to pork, with the slaughter improvements, they were able to meet everything they would have gained with the on-farm program using the 2003 standards. So what we look at is implications for the United States if we were to look at on-farm processing and or on-farm control. And one of the reasons that, to pull this back full circle, that we start wondering about on-farm control is that if our baseline goes really low and we have to start getting to below half of what an already low baseline is if we're doing everything we can in the plant, will doing something on farm make a difference to that baseline or to those positives in the plant? What we're seeing now is in our large establishments, we already have excellent control. We're somewhere around where the Danes are, in that anywhere from 0 to 1.4%. Average that for the last 2 or 3 years in the large establishments. Now, granted, that is our HACCP testing. That's not a national baseline. It's not necessarily statistically valid. However, because it's HACCP testing, they're over-testing the plants that have had problems, and the plants that have no problems are probably being under-tested. So we'd say as our current testing indicates at or below the average of the Danish establishments. Our small establishments in the United States provide very little of the pork consumed by the general public, but those are probably the areas where we could see improvement with either on-farm controls or more controls at the plant. Even with those controls implemented, it may have little impact overall on public health or pork safety because so little meat goes through there. And we do know that the cost of on-farm controls and monitoring is a real concern. Last time we were in Denmark, when the Danish program started, the Danish government was paying for monitoring and testing. And they were doing things like running every ELISA and duplicate. Well, then partway through the program, the government said, well, we think the producers should pick up this cost. But the last time we talked to them, they were still paying somewhere around 25 cents per pig just for monitoring and testing. And that didn't include any interventions they may have done on farm. So, you start multiplying that by 25 million pigs a year and it becomes real money. So in summary, from what we're looking at in the pork industry is that we really feel salmonella reduction is a team approach. There are things we have to do on farm to deliver healthy animals to the plant, and there are definitely huge impacts at the plant for what the end outcome of carcass contamination will be. Our carcass testing is showing a low prevalence. We're at 2 to 3% across all establishments. Our largest establishments consistently are below 1.5%. And we do have good evidence that the interventions in the plant do provide a real decrease between stun and to what goes into the cooler.